Hello everyone. Myself Dr. Dipak Suresh Bathe, consultant physician from Durgapur, West Bengal. So on this World Heart Day, I will talk with you one important topic, that is understanding hypertension. So let's take a look on some statistics by World Health Organization. There are around 1.28 billion individuals aged between 30 to 79 are affected with hypertension globally. And among them, 46% are unaware of their hypertension status, and 42% are only treated and diagnosed with hypertension. And one among the 5 individuals is only have controlled hypertension. And hypertension is one of the major cause of preventable death globally. And it is one of the global target among the non-communicable diseases is to reduce the prevalence of hypertension by 33% between 2010 and 2030. So now we will see what is hypertension. Before hypertension, we will see what is blood pressure. The blood pressure is pressure exerted by circulating blood against the wall of arteries. So blood pressure has two terms in that. That is, one is systolic and one is diastolic. The systolic blood pressure is the pressure inside the arteries when heart gets contracts. And what is diastolic blood pressure? Diastolic blood pressure is the pressure inside the arteries when heart gets relaxes between the beats. So normally healthy individual has blood pressure below 120 by 80 mm of mercury, and the pressure between the systolic blood pressure between 120 and 139 and diastolic blood pressure between 80 and 89 is a pre-hypertension stage. That is, this individual has a high propensity or high risk to develop hypertension. And blood pressure above 140 by 80 mm of mercury, above or equal to 140 by 90 mm of mercury is known as hypertension. So blood pressure individual can measure in home by themselves also, but evaluation by healthcare professional of blood pressure is very important for assessment of risk factors and associated diseases. So let's now see the symptoms of hypertension. So usually hypertension doesn't have any obvious symptoms or signs. So that's why it is called silent killer. But if some symptoms do occur, so they are like morning headache, irregular heartbeats, buzzing in the ear, nosebleeds, etc. And severe hypertension can cause anxiety, irregular heart rhythm, and nausea, vomiting, and chest pain, and anxiety, and confusion also. So now we will see hypertension usually don't have signs and symptoms. That's why it is usually we can't detect by signs and symptoms. So usually patient, only one way to detect the hypertension is to measure it. So usually after 40 years, every individual should screen for hypertension. So now we will see some risk factors for hypertension. So in risk factors, the risk factors are classified into two major groups. That is, one is modifiable and one is non-modifiable. So among modifiable, the risk factors are having lack of adequate physical activity, having unhealthy food, and habits of smoking and alcohol consumption, and being obese or overweight. And among non-modifiable factors, they are age, that is age greater than 65 years, and having family history of hypertension, and having associated diseases like diabetes and kidney diseases. So let's take a look on some complications of hypertension. If hypertension is left untreated for long period, so it will create some complications like chest pain, that is also called angina, heart attacks, that is blood flow to the heart gets blocked, and heart failure, that is heart is unable to pump adequate oxygen and blood to the vital organs. And hypertension can cause kidney diseases like kidney failure, etc. And even hypertension can cause burst or blockage of arteries that is supplying blood to the brain also. It is also known as stroke. And one of the important complications is also irregular heart rhythm that can cause death also. So now we will focus on preventive strategies, some of strategies to prevent or control of hypertension. So among them, one is having regular physical activity or exercise. So it is recommended that 30 minutes of moderate aerobic activity is recommended every day. That is around 150 minutes of moderate physical activity every week, or around 75 minutes of vigorous physical activity per week. And second one is important factor is having a healthy diet. So one is one of the dietary intervention to prevent hypertension or control hypertension. It is known as DASH diet. DASH stands for dietary approaches to stop hypertension. So DASH diet usually have adequate amounts of whole grain, vegetables, fruits, and less amount of fatty foods. And in diet, one most important thing I want to focus is reduction of salt intake. Usually, reduction of salt intake usually has very good impact on reduction of blood pressure also. And even salt reduction can make your antihypertensive medicine very effective also. So third is managing your stress. So every individual should know that how to relax and how to manage their stressful life. So some of the strategies for reduction of stress is listening to music, having regular physical activity, and meditation. And one of the important things is quitting smoking and alcohol consumption. Usually quitting smoking and alcohol consumption prevent the complication of hypertension and improves overall health also. So now I will focus some time on the monitoring of blood pressure. Usually, it is not possible every time that patient will visit visit doctor for measurement of blood pressure. So usually in my practice, I usually advise them to monitor their blood pressure in their home only. So per week, 2 days of monitoring of blood pressure usually suffice. So per day, usually they have to maintain 3 readings after waking up from sleep, after evacuating bladder 1 reading, in afternoon around 2 to 3 o'clock 1 reading, and evening around between 6 to 10 o'clock 1 reading. And and I advise them when they come for my consultation, so they usually bring that data with them. So usually this monitoring helps me to overlook on whole day blood pressure, and usually helps me to adjust my medication dose also. So while monitoring, some important points we should take in mind that during blood pressure monitoring, that blood pressure monitor should be at the level of heart level, and patient should sit on chair comfortably with their feet touches on ground, and elbow and forearm should be on resting surface. Third important thing is that patient should not measure their blood pressure after having exercise or strenuous physical activity, or after drinking caffeine, after drinking coffee, or after smoking, or after having heavy meal, or if patient is in under stress or upset, or if he is in hurry, he should not take blood pressure measurement at that time. And last point is I will talk about adherence of medication. So what is adherence? Usually patient should take antihypertensive medication regularly and on time. So it will create overall control of hypertension throughout day and helps in reduction of complication also. So with this, it is we can maintain our blood pressure normal by proper monitoring and having preventive care. So with this, I am signing off and wishing you healthy life. Thank you.